I graduated from Baptist here in 1982 from the diploma nursing program. And then, as it is now, Baptist was the place to come to if you wanted a quality education. But then when I felt like the calling of teaching was on my life, Baptist was the only place I considered teaching. I knew the quality of the nursing program here at Baptist, so I thought that's where I need to go.
I came back to teach at Baptist because this always felt like a home to me. The people here are kind, compassionate, they really care about your life. I feel Baptist College really provides an individualized opportunity for the students to work with instructors one-on-one. It's awesome to see the students grow.
There is a vast difference between going to a college or a university where you're one of 300 in a classroom. At Baptist College, you're going to be one of maybe 30 students in the classroom. That allows the instructor to really hone in onto what your strengths are, what your weaknesses are, what your learning capabilities are.
The class sizes here at Baptist are pretty awesome. And I know I have friends that talk about the other schools they go to, and they have over 300 people in one class. So when you do have that few number of students in a class, you really get that one-on-one experience with your professors. And here at Baptist, we're just walking down the hall, all your professors know you by first name, and I still say hey to professors I've had since I've been here in my very first year.
You get so much more one-on-one attention than classes I'd taken at other schools in the past.
I really wanted to have that time with my instructors so I could obtain the most knowledge and seek clarification when I needed it.
The uniqueness of Baptist College, the instructors who may be teaching you in the classroom may be those same instructors who are there helping you to grow as a clinician in the clinical environment.
We have students are always a little anxious about really going into the hospital setting. So to help prepare them for that, we have state-of-the-art simulation labs that allow them to first practice their skills on simulators and sometimes on each other, depending on just what the skill is, before they go to the hospital setting.
I really want to be the best that I can be, and I feel like Baptist is going to lead me there in preparing me just mentally and just knowing all the pathologies that I need to know. I feel like they're going to equip me with the basic skills that I need to be a sonographer.
Yeah, here at Baptist we get the opportunity to get some great internships. Mine on the cardiovascular intensive care unit. That every patient has like 6 or 7 IV pumps. It's really intense. A lot of them are on respirators. The learning experience is just, it's unbelievable there.
Baptist offers you so many opportunities to go out and into different clinical settings. Therefore, you get so much experience and it broadens your lens up so much to see what you can do out there as a nurse.
I'm seeing so many things that I never thought I'd do. I'm doing things that I didn't even know radiographers did. I mean, there have been procedures where I stayed in the room with the patient just to talk to them, make them feel comfortable. And I mean, I've never been able to do that just inside a class.
I spend 24 hours a week in the hospital working with patients and scanning patients and doing what I would do if I was working. And so it's a really good experience for me for when I graduate because I'll already have been doing sonography for 2 years before I graduate.
And so coming to Baptist College allows students to get that nurturing, especially for students who are coming from a high school background. It is so important because these students are coming with a lot of questions, and as educators, if we can answer those questions not only as it relates to what they're learning, but questions related to what does it mean to be a clinician, what does it mean to be a healthcare practitioner, the students will get that, and it will just make them a more effective, not only learner, but more effective healthcare provider.